Hi everybody, I'm Dr. Tim Chrisman. I'm a chiropractor, clinical kinesiologist, and functional nutritionist in Dallas, Texas. Today I'm going to explain one of the most common causes of low back pain, or back pain in general, and the relaxing, non-cracking adjustment that we do to correct it. We're talking about the sacroiliac joint. I'm going to get a little technical in my explanation, so just understand this is like the interlocking gears in a clock or an engine. If one gear gets even slightly out of place because of a loose screw, all of the other gears grind along harder and they lose their flow together. So back to the sacroiliac joint. When this joint in the pelvis gets misaligned, the spine is unbalanced, as you can see in the diagram, and then it goes through this adaptive process where the nerve reflexes try to minimize the stress and energy drain on your system. So it doesn't necessarily put things back in place. It helps your body adapt to the interference. And it does so by over-facilitating the muscle tone on one side and inhibiting the muscle on the opposing muscle on the other side. Demonstrated just so. Okay? It's like a reflex, an unconscious reflex. When you do, when you do a bicep curl, you're able to move the arm because your triceps turns off. It does so automatically. And in the spine, this happens in an alternating fashion all the way up, creating a zigzag type of effect. That actually reduces the range of motion and increases disc inflammation at specific points along the way. These points generally occur at the junctions between your lumbar, thoracic, and cervical regions of your spine. So specifically at L5, S1, T12, L1, and C7, T1. So the disc inflammation, which is really the big point here, interferes with nerve roots coming out of the spine, going to everything that those nerves are connected to in the periphery, which could be bone, blood vessels, internal organs, or otherwise. And this is why you should pay attention to this and get checked for this problem. Not just because of pain, because these nerves don't just go to pain receptors. As I said, they also go to internal organs and they can affect autonomic functions like digestion, heart rate, and blood pressure. So correcting this problem, and for that matter, all other subluxations, correcting all other subluxations in the structure of your body can eliminate nervous system interference and make your insides work better. You may be shocked at what adjusting this one joint is able to do. I've seen it reduce gallbladder attacks, muscle spasms, premature contractions in a pregnant female, and it can actually help allow a release of stored emotions or stress and facilitate healthy bowel movements. People generally feel more centered over their feet, and they may notice a difference in their gait or ease of movement. And of course, you can get a reduction in the elimination of pain, and then once again, breathing room in the spine is restored. So how do we fix this? You're probably most familiar with the side posture adjustment where the doctor puts you on your side, puts a high velocity force into the pelvis to get that joint to move, but I prefer to use a different, gentler, and more relaxing adjustment technique using pelvic wedges. So these wedges are placed under the pelvis in a specific way to realign the joints with the help of gravity and the patient's weight. This happens without forcing or high velocity jerking movements and without cracking. And so in just a few minutes, this problem is corrected. But just after the adjustment, when you start moving and walking around, your body starts to unwind from the adaptations that the displaced joint caused, and then motion is restored, disc inflammation goes down, and nerve expression flows at a more normal rate once again. So far, we've just discussed one joint and one particular type of dysfunction, but there are several other ways that the pelvis can settle out of position. Also, you have 24 vertebrae, 22 independently moving cranial and facial bones, and all of the bones in your arms, legs, hands, and feet, all of which can suffer some degree of displacement or dysfunction in relationship to the others, from nerve interference or creating nerve interference in their own right. If you haven't had your spine checked or adjusted in some time, or if you've never gotten your spine and nervous system checked, now is a good time to do that. Give me a call or send me an email for a consultation. You can find my information below the video, but you should also see it here on the screen as well. Hopefully you'll subscribe and like the video so other people can find out more about this. Also hit the bell for notifications when content is uploaded, and thanks for watching.